So what we're going to do today is show you another component of our lower quarter functional examination testing sequence. So as we go through this, we keep in mind that we use the lower quarter functional examination, the LQFE, to determine dysfunctional movement habits and patterns that our patient might be using that is potentially driving their pain state. So what we're going to do is, one, check to see what their passive mobility is. In this particular test, we've already done that in supine with the hip abduction external rotation test. And so go back and reference that video. But we've established her range is up to about here. If she moves and we see dysfunction above her established range, that's not what we're looking for. That's not an active dysfunction. That's more of a result of passive tissues reaching their end range and then moving its neighboring component. So not what we're interested in. Then what we're going to do is ask her to move in such a way that she's relaxed in her torso, and we're going to see what her movement habits and patterns are. Then we're going to ask her to repeat the test with a contraction of her VPAC. It's a categorical pool of active torso contraction strategies, such as abdominal drawing in maneuver for the local system, abdominal brace maneuver for the global system, and then we have variations thereof, and you can reference those videos as we go through. But what we're looking for is we want to determine what happens when we increase her active proximal stability to her movement. So in this case, we're going to be testing rotation control of the hip, and while we're really looking at rotation control, we're going to look at 3 dimensions. We're going to come back and look at what's happening in the frontal plane, what's going on in the transverse plane, and then what's going on in the sagittal plane, looking down at her. And so we might have them repeat the sequence as we move to get a good vantage point. All right, so we've established her passive range, roughly here in the supine test. So now we're going to ask her to keep her feet together, and we're just going to use simple, non-instructive language to tell her to perform the movement. In this case, I'm going to say, keep your heels together and move your knee up to the sky. We're going to see what happens. Good. And then you can do that and have her repeat that without any contraction, looking from different vantage points. Okay, so now what we're going to do, we're going to choose the VPAC strategy that we're want to examine. So in her case, she's been coached up on abdominal drawing in maneuver, and so we're going to palpate inside of ASIS. We're going to sink our finger down into our abdominal wall and then use her preferred cue. In her case, it's build pressure under my thumb to activate that transverse abdominis internal oblique, the local system. You might even see a little bit of tone build in her erectors back here, which is quite nice. Now keep that contraction, keep your knees together, lift feet together, lift your knee to the sky, and we'll see what happens. Good. We're going to see if there's a difference, and then we're going to come to a decision about what to do.